Okay. Good morning. I hope this is, yeah, this is picking up my voice. Yes. Assuming you can hear me okay.
Yes, yeah, can hear it and all that.
All right. So this probably won't take super long. Um, Even on here, like, hold on really quick. Why is this not leaving? Hello, computer. This is. Oh, we are only doing chapter 24. Okay, cool. Okay, so let's just get into it. This probably will be a pretty short one, simply because we're not doing any other chapter except for 24. And for the most part, like that was pretty straightforward chapter, I felt like. So we'll go over our genitourinary diseases and the most missed topics associated with that chapter. Again, mostly covering STIs, but we did talk about urinary tract infections, vaginosis, as well as leptospirosis. All right, so just to review our major concepts that we covered. Females often have their biome might have lactobacillus bacteria involved in it. That's a pretty common one that we see, as well as even low numbers of Candida albicans. While Candida albicans is usually associated with yeast infections, having low numbers is a normal part of the biome, but it's when it overgrows that it becomes a problem. In men, we often have changes with sexual activity, and then being uncircumcised also usually is going to have incorporation of a biota that lends to more inflammation and can make you more susceptible to STIs. For urinary tract infections, 80% of them are from E. coli, from the endogenous GI flora. And this is a similar thing to what we see with prostatitis in men. Again, similar sort of situation. In men, though, more often than not, this is going to be associated with unprotected anal sex. In leptospirosis, this is a bacterial disease. It is a zoonotic disease maintained in animal populations. It has two phases of the disease, the leptospirosis phase, where we have severe flu-like symptoms, but then the immune phase that can lead to meningitis and more serious complications systemically that can eventually lead to death. It is transmitted in the urine. Vaginitis is, again, if we have itis, we have inflammation of the vagina as a pronounced effect of this disease. I hate this pen. If I put the pen down on the slide for too long, it like just pops up with a toolbar. So it's very frustrating, but it is what it is. So vaginitis can be caused by Candida albicans, which is yeast, which is part of your normal biome, or a protozoa, Trichomonas vaginalis. And so this one is always going to be STI associated, whereas Candida albicans is just overgrowth of the biome. So that would be an opportunistic infection, whereas Trichomonas vaginalis is probably what we consider a true pathogen. And we have vaginosis. Well, we have infection in the vaginal canal, and we usually call this bacterial vaginosis or BV. And this is due to a decrease in the lactobacillus population, usually due to sexual activity, just causing a shift in the pH and in the normal environment, causing the lactobacillus guys to decrease in number, and then other bacteria are able to grow in their place. Gonorrhea is an STI that's caused by the gram-negative Diplococcus, which we call the gonococcus, and this is Neisseria gonorrhoeae. So one thing that I do want to mention that I have really, all right, one thing that I do want to mention that a lot of people will ask me about, like, well, how many meta questions do we have on the exam? I want to be kind of clear about this. Is like, that's a hard question to answer because it depends on what you think is meta. How many of these questions am I going to have you guys like break it apart and break it down into severe detail? None of them, because I can't do that on a multiple choice test. But how many questions might cross units? I will say most of them will. And we're talking about a 100-question quiz. But when I say that, so here I've mentioned that gonorrhea is caused by a gram-negative diplococcus. So I might ask a question on the exam that would be something like, your patient is suspected to have gonorrhea. When they do a gram stain on the patient sample, the pathogen, gram stains red and has small circular shaped cells that are linked in pairs. Is this consistent with the diagnosis? To me, that's not a meta question. To me, that's baby stuff. But that's like most of the questions on the exam will be stuff like that. Because I'm just expecting you to remember that gonorrhea is caused by gram-negative diplococci, which is a characteristic of Neisseria in general. But if I say it in this study sheet, I reserve the right to pull it out of the study sheet. So is it a lot of info? Yes, but I'm only going to pull info that's on the study sheet. But be aware that you have to understand what's on the study sheet. So if I'm talking about something like gram-negative spiral bacteria, Treponema pallidum. If I'm talking about a protozoa, Trichomonas vaginalis. And I don't know, we talked about like Ascaris. This is killing me. This pen. Oh my God. All right, whatever. If I talk about herpes and I talk about chancroid, now you'll only have one that would be correct if I were to ask a question. But like if we talk about gonorrhea, your patient, you have a patient that might have gonorrhea, chancroid, herpes, or Trichomonas vaginalis. We don't know. I mean, I feel like you should know based on the symptoms, but hey, let's just say we don't know. If we have, these are our 4 choices. And in your patient sample, the pathogen shows cells that have mitochondria. Which of the following could it be? It can only be this one, Trichomonas vaginalis. Because bacteria that cause gonorrhea, bacteria that cause chancroid, and then virus that cause herpes, none of those pathogens have mitochondria. So that's the level of understanding that you'll have a lot of questions, and I mean a lot, that are going to be like that sort of stuff. Or which of the following is caused by a bacterial disease? Or which of the following is caused by viruses? There's a lot of questions like that on the test. Or relating back to something we know about viruses or protozoa or fungi, which of the following could be a eukaryote? So that sort of stuff. All right. Anyways, and I might be asking about the disease. I might be asking about the pathogen. And there's so many questions that I can ask in that regard. Remember how we talked about firmicutes, gracilicutes, mendozicutes, and tenericutes. So remember that firmicutes were the gram positives, gracilicutes were the gram negatives, tenericutes did not have a cell wall, and mendozicutes were the archaea. So there might be questions on the test that say, which of the following is a gracilicute? I don't give you a list, and you have to find the one that's the gram negative. There's a lot of questions like that. I would say most of them are like that. So taking the knowledge, I said, to me, that's not a meta question. A meta question would be asking a lot more detail with a lot more information. So to me, that's not a critical thinking question. To me, that's not a, so people keep asking me like, how many critical thinking questions? I don't know what you think a critical thinking question is, like, period. Like that's pretty much what my answer is. Depends on what you mean. If you mean direct, like, what is the cause of herpes? And you would have to know HSV. Like, there's not very many questions like that on the test. Very few. So if that answers the question better. I tell people prepare for the whole test to be extremely meta. I feel like it's like baby crossover kind of questions, but if that helps people study, I don't know what to tell you. But anyways, where were we at even? We were at, come on. We were at talking about gonorrhea being caused by the gram-negative diplococcus, Neisseria gonorrhea. Chlamydia is caused by Chlamydia trachomatis. It's also the bacteria that causes trachoma, the leading infectious cause of blindness in the world. And chlamydia is the most common of the reportable STIs. It's not the most common STI. It's the most common reportable one, the one that they're actually tracking. The most common STIs, well, we don't even track them because they're so common, there's no point. So that would be for the ones that we cover here, HPV is the most common, then herpes, and then trichomonas. Then our most reportable ones would be coming in with chlamydia and gonorrhea and syphilis and chancroid and all that. All right. This syphilis is a bacterial sexually transmitted infection. It's caused by a gram-negative spiral bacteria. So, for example, in these study sheets, if I don't mention that it is gram-negative or gram-positive or a protozoa or something like that, I'm not going to ask you questions about it. So if you see up here, leptospirosis, it's a zoonosis. It has these phases in the disease. Do you notice how in leptospirosis, I haven't mentioned that it is a bacteria or a protozoa or anything like that? Well, that's an oversight in my part in making this study sheet, but that's not you guys' fault. So I'm not going to ask any questions about it being a bacteria, but I'm still going to ask questions about it being a zoonosis or exhibiting flu-like symptoms versus meningitis in the different phases or something like that, right? I'm literally pulling it out of this. I'm literally pulling out of the study sheet. All right. Because I tell you guys the study sheets, what you need to know. You better know what is, if it says a thing about it on the study sheet, you better know what the thing it means at the very least. But yeah, if I didn't talk about it on the study sheet, I will not be asking questions about it on the exam. Just saying. That's been the truth since the beginning, just FYI. People be like, no, that's not true. It is absolutely true. Bet. So, bet. It only ever comes from this. So, FYI. Just that helps you guys studying. All right, so we have three different phases in syphilis: primary, secondary, and tertiary. These are basically going to be the chancre at the site of the entry. That is a hard, painless bump that appears at the site where the bacteria get into the body. The secondary syphilis will develop whenever we start having lymphadenopathy, which just means swollen lymph nodes, fever, or sore throat. So you start feeling sick, like much more systemically at this point. And then you'll have this very characteristic reddish brown rash on the palms and the soles of the feet, as well as it can appear on the trunk of the body, pretty much anywhere on the body, but it's very characteristic for it to be on the soles of the feet and on the palms. In tertiary syphilis, we will have gummas developing, which are these lesions that are they look like kind of necrotic tumor-like growths on the face, and they cause damage to the tissue underneath over time because syphilis is a highly inflammatory organism. And so this will lead to the development of the gummas, often on the face and the body, very disfiguring. Neurosyphilis, whenever it moves into the nervous system, we might have blindness that can develop as well as dementia. In congenital syphilis, this is whenever a baby is being grown in a womb where the woman has syphilis or is born through the birth canal and exposed to the syphilis that way. Either way, if they are getting syphilis in the womb during development, this can lead to fetal abnormalities, miscarriage, and stillbirth. Next is chancroid. This is caused by Haemophilus ducreyi, which you will see I say is a gram-negative bacilli. This doesn't say directly that this is a bacteria, but if I'm saying it's a gram-negative bacilli, that means it's a bacteria. So now I get to ask questions about bacteria stuff on this guy. So just FYI, nothing else is going to be gram-negative except bacteria. So this is a gram-negative bacilli. It is a rod-shaped bacteria. It is an STI that forms a soft chancre on the area of exposure, as opposed to the hard, small one that was associated with syphilis. This is a soft one. It's larger as well. Next is HPV. HPV is the most common STI overall. It's associated with genital warts as well as silent infections and cervical cancer. Most of the time, your body will be able to clear this out pretty naturally if you have the cervical cancer versions. If you have the genital warts ones, these typically don't go away as easily, just so that you know. But that's less common than the ones that are associated with cervical cancer, because the ones associated with cervical cancer are going to be more silent infections. So people are spreading that without knowing that they have it. There is a vaccine that prevents the more common genital warts and the cancer-causing versions of this. So we do have vaccines that are available to prevent cancer, basically. This is the Gardasil vaccine. All right, next is herpes. Herpes is caused by herpes simplex virus. We have either herpes simplex virus 1 or herpes simplex virus 2. Both of them can cause oral herpes and both of them can cause genital herpes. HSV1 is typically more commonly associated with oral herpes, and HSV2 is typically more commonly associated with genital herpes, but having one or the other doesn't protect you from getting the other one. Neonatal herpes that is spread to the baby during birth if the mother has an active, vesicular rash that, comes from having a herpes outbreak. If she's having an active outbreak and the baby is exposed to it, it can lead to up to 80% mortality due to meningitis if the infection spreads to the central nervous system. So in those cases, C-section is advised. It's compulsory, really, honestly. Then latency of the ganglion is talking about the fact that the HSV virus, once you have it, these guys will move deep into the nervous system and can even hide out in your central nervous system in your immune privilege site, so that your immune system can't kill off your virus. It can't kill off the cells infected with the virus, because your central nervous system is basically your immune privilege site. So the deeper that these viruses go, the better they're able to hide out. And then when you're stressed out and your immune system dies out, then these guys get the opportunity to come out back to the surface and form these vesicles that allow them to spread to new people and stuff like that. Taking, there's no cure for this, but taking acyclovir, which we talked about in a previous chapter, and which I will ask questions about on the test, I'll start talking about, what medication might be used to treat this disease. And it's diseases that we didn't directly say have a cure or a treatment or anything, but if you know it's a bacteria, you're going to be using an antibiotic. If you are treating malaria, you're going to be using a quinine-based drug like chloroquine. If you're treating herpes, you're going to be using acyclovir or valacyclovir or Valtrex, but I'll probably call it acyclovir on the test because that's what your study sheet said for your Unit 3 study guide. So anyways, then we have Group B strep colonization. About 10 to 40% of women harbor Group B strep in their vaginal canal. So we'll test for this at week 35 to 37. And then treat the women with a penicillin-based antibiotic to try to clear this out so that the infants aren't exposed to it in the birth canal, because it can cause life-threatening conditions such as, meningitis and pneumonia and things like that in the babies. All right, so our most commonly missed topics for this week, we have obviously it's all chapter 24. We have first the HPV. HPV, one of the questions on the test where I'll ask something like, what's the most common STI? People are missing this one. It's HPV. It's HPV. It doesn't always cause warts. It sometimes, most often, causes a silent infection, and in some cases can progress into developing cancer. This is not just cervical cancer, but it is also associated with other cancers, including anal cancer, penile cancer, and throat cancers. For our high risk types. The low risk types are the ones that are associated with genital warts. We consider this harmless. It might be disfiguring to the patient, but it's not going to kill you. It's just, just ugly. But our high risk types, like that are linked to the cancers, these can actually kill you from cancer. And so those are our high risk types. Most of the time, HPV infections are going to be asymptomatic and they will clear on their own. When symptoms occur, it may include genital warts or signs of cancers. That is much rarer. That's the whole importance of Pap smears, is screening for this stuff so that people don't get cancer and die from it. And it's been incredibly helpful in reducing those numbers. HPV, hiding in plain view, pass through passion. It's the most popular STI. Most people are going to get it if they're sexually active. How is human papillomavirus transmitted? Is it transmitted through the air, through contaminated food and water, through skin-to-skin contact during sexual activity? It's an STI, so I would hope that we would know this. Or by sharing personal items like towels. The virus usually doesn't transmit well through like fomites and things like that, it usually has to be skin to skin contact, like many other wart causing viruses, which they're all HPV. It's just whether it's genital version or on your skin. When you get a wart on your finger, that's HPV. It is transmitted by a virus. It's usually touch to touch that's going to transmit that. It doesn't transmit super well on fomites. So which of the following is true about HPV infections? Most HPV infections cause immediate symptoms. We already talked about it. It's a silent virus for most people and will be cleared easily. All HPV infections lead to cancer. This isn't true either because some of them have genital warts or might just be silent and may clear by the body naturally. Majority of HPV infections clear up on their own without causing harm. Yes, it's probably this one. And our last choice, HPV can only be spread through vaginal intercourse. And this is not true. We already talked about how it can be spread to the anus. It can be spread to the throat as well. So that's not true. Any sexual contact can spread it. All right, our next topic was syphilis and the different stages of syphilis. Knowing that our primary stage has that chancre, that hard, small lesion, that bump where the bacteria got into the body. The secondary is basically really characteristic by rash on the palms as well as the soles of the feet, particularly, but it can be anywhere on the body. And then the latent stage of syphilis is whenever the bacteria are in the body without causing symptoms. We didn't talk about that much, but it is a possibility to go latent with that one. But our tertiary phase, 1, 2, 3, this is latent. Tertiary phase, if it progresses to late stage syphilis, now we're talking about the gummas, which are soft tumor-like growths where we have degradation of the tissue that's involved, including loss of bone and cartilage underneath it. Complications like heart disease, blindness, and neurological symptoms can occur, and it can be fatal if it is not treated, if it spreads throughout the tissues like that. Primary treatment for syphilis is going to be with antibiotics, in particular, penicillin G, which is the injectable version of penicillin, very easily treated for this one. So in syphilis, it's our little mnemonic here with silly people leave terrible scars. Silly is representing that primary stage of syphilis where you'll have this chancre that is usually going to go unnoticed at first. Then people, of course, talking about people getting infected, but also the painless rash that is associated with it. Leave is the latent stage. If you go latent, you will not have any signs or symptoms, but you're still going to have the bacteria in your body. And terrible referring to the tertiary stage that actually has very terrible consequences like the gummas and life-threatening complications. And then actually can cause scars, literally, due to the damage that's being done there. All right, so we know syphilis is caused by bacteria. It's caused by, come back to this, the bacteria Treponema pallidum. In our study sheet, we also learned that it's gram-negative. We already said bacteria, but it is what it is. So it's gram-negative. It is bacteria. And its name is Treponema pallidum. We have the 3 stages: primary, secondary, and tertiary. Yes, there's a latent phase. Latent phase is the same in every single disease ever, so I'm not going over that one. But primary is defined by the chancre. Secondary is defined by the rash. And tertiary is defined by the gummas, as well as neurosyphilis. All right. So those are little notes for these questions. So our example questions: what is the characteristic sign of syphilis in the primary stage? According to my notes down here, that's going to be the chancre. So we don't have a painful rash with this one. We have a painless ulcer called a chancre. We don't have swollen lymph nodes. That's in secondary. And we don't have mucus patches in the mouth. That's actually usually associated with secondary, but we didn't even talk about that. And so if it's not on my study sheet, I'm not going to ask you about it, right? So which stage of syphilis is characterized by flu-like symptoms, a rash, and mucus patches? All right, well, we've got a rash. Which one's characterized by a rash? That's going to be secondary. Primary is the chancre, latent, no signs and symptoms, and tertiary is going to be the gummas and the neurosyphilis. On my exam, when I ask you questions about primary, secondary, or tertiary syphilis, I will be talking about these more obvious things that characterize this. I'm not going to say which stage of syphilis has lymphadenopathy. Even though I talk about that in the study sheet, I feel like having swollen lymph nodes, which is lymphadenopathy, is a common sign and symptom in a lot of diseases. It's not very characteristic in my mind, so I'm probably going to be focusing more on the more characteristic aspects, just so you know. And yes, that should make it easier, but for some reason still people have this problem where that gets mixed up in your brains. And I feel bad for you for that, but at the same time, you have to work through that stuff well enough that you aren't going to get it confused when you get onto the test. Other people will be like, well, I have stress anxiety or I have testing anxiety. Every single person does. I promise you they do. So it's a matter of you have to learn how to take the tests in spite of that testing anxiety. You have to, and it's not going to stop. That test anxiety isn't going to go away when you get into nursing school, right? I don't know why you would think it would. So you've got to learn to accommodate it. So whatever. So, okay, moving on. Chancroid. This is a sexually transmitted infection. It is caused by the bacterium Haemophilus ducreyi. Like how, like, I know I have my camera on and you guys can probably see me, but I'm like yell, like when I talk, I like lean into the microphone. Like I'm like, it's like crazy person stuff, but whatever. All right. So this is a bacteria called Haemophilus ducreyi and is a sexually transmitted infection. All right. So oftentimes our first sign will be our chancre. Again, it has a soft chancre in this case, and it's larger than the one that's associated with syphilis. For a lot of people, this can be painful, but many women are less likely to notice the infection. You also might have swollen, painful lymph nodes with this one. It's more commonly associated with sexual transmission, usually with sex workers. And in men, it's more commonly associated with being uncircumcised. Again, not uncommon to see in the case of someone who is uncircumcised, having that inflammatory biome that makes you more susceptible to getting STIs in general. So chancroid, associated with these larger chancres that are a little more painful and have this very distinct soft shape to them with an irregular edge. Right. Moving on. All right, so our primary symptom of chancroid, I feel like it's in the name. That's going to be that soft chancre. This time it's soft and larger. In syphilis, it's going to be the hard chancre. So this is going to be a painful genital ulcer. Not a rash. It's this ulcer that we call a chancre. Which bacterium is responsible for causing chancroid? This is Haemophilus ducreyi. Treponema pallidum causes syphilis. Another common type of a question that you'll see on the exam is this. This is a more direct, this is as easy as it's going to get on my test, is this kind of question. So, what bacteria causes chancroid? Very direct. You don't need to know anything about bacteria or eukaryotes or anything like that to answer this question. This is the easiest type of question, and there's not many of them on the test. So, what bacteria is responsible for chancroid? Haemophilus ducreyi. Treponema pallidum causes syphilis. Neisseria gonorrhea causes obviously gonorrhea. And Chlamydia trachomatis causes chlamydia, also known to cause trachoma, which is the leading infectious cause of blindness in the world. So, like I have said previously, most of the questions are going to be something more along the lines of which of, like, not for these particular choices, because this is all kind of very similar organisms here. They're all STIs, they're all bacteria here and everything. But if I might have a question that says, which of the following are eukaryotes? And it might be all of these, and one of the choices might be all of the above. In this case, these are all bacteria. These are all eukaryotes, so it would be all of the above. But that's taking it to the point of you need to know they're all bacteria. That's the easy part of it. But you also should know that bacteria are eukaryotes. To me, that is also easy. Most of the questions are going to be that, though, where we have a little bit of crossover into other units. Bet on almost every question being like that, if not harder than that. And you'll be well prepared for the test. All right, that is it for our review today. Anybody have any questions about anything while I am here? We will be having our Kahoot game on Sunday at 4 p.m. And keep in mind, like when you guys are taking microbiology, the whole goal is to get to the final comprehensive exam where you get to show me how all of these things relate to one another and how they're interconnected. And so you can show me your understanding of the topics. If I just wanted you to regurgitate terms, I'd just give you lists of terms to regurgitate, but you're not supposed to learn that. You're supposed to learn how all of this stuff works together. So the final exam isn't there to be a boost to your grade. In fact, even if you got a good grade on the final exam, the likelihood of it raising your grade is almost nothing. It's not worth enough of your grade to raise your grade a lot. You might be able to raise it some, play with your what if calculators and look at what you might be able to do. But if you're somebody that has a C, there's no chance of you getting an A in my class at this point. Most people will not have a raise in their grade. Almost everybody will stick with whatever grade they have now. The only thing that's going to help you out much is going to be the extra credit. And there will be a post on Monday. So the extra credit is already set in stone. You either got the extra credit or you didn't, except for the evaluation extra credit. So if you haven't done the evaluation extra credit, do the course evaluation so you can get that extra credit. Otherwise, you're just getting the extra credit for having done the syllabus quiz, which everybody had to do just to unlock the course. So everybody's getting at least 0.2% added onto their grade for doing the syllabus quiz. So you can call that a curve if you want to, but it's 0.2 is what you're getting for doing the syllabus quiz. So everybody gets that. Everybody that was in my traditional classes, if you came to class, everybody in my traditional classes is getting 1% added on for participation. If you are in my online classes, you had to submit a separate form with your answers to the questions at the end of each lecture. And you had to submit those forms before each unit exam. There is no exception to that. So if you start submitting your forms for units 1, 2, and 3 questions, at this point, you will get a 0 on those, and you will only get credit for the unit 4 one. You guys had your chance to submit that in. There's no going back for that. It's not do it all right now. They had to be turned in by each exam, and it says that in the assignment. So there's that too. So those are possibilities for you guys to get extra credit. So you might have gotten 1% for that. You will get the rest of your 80% of the other 1%. You get 0.2 for the syllabus quiz and you get 0.8 for doing the course evaluation. And then if you have the appropriate number of zeros or whatever, then you might be getting another 1% for the course completion. Now, I'll be honest, about half of the class, half of all of my students are getting that, which is pretty impressive when you consider that. Most of you guys actually did your required work and didn't get any zeros on that. So that's the only thing that will be, added on to your grade on Monday. I'm adding that in for everybody. And I'm making an announcement about it just so that you are clear. On Monday, before you take the exam, if you're a Monday exam person, on Monday before you take the exam, your grade on there will have the extra credit added in, but it will not be extra credit until you take the test. It'll be counted as a grade, and it so might not raise your grade at all when I first add it in. It will only be extra added onto your final overall grade once you take the exam and your grade posts. And I'm making an announcement about it because if you didn't do the extra credits, if you didn't do the course evaluation, if you didn't get the extra credit for not getting zeros, that stuff, then you're going to get a 0 on that extra credit. And until your final exam grade posts, your extra credit is going to count as an actual grade. And so that will bring your grade down if you got less than 100 on it for most people. And people are going to email me and be like, my grade went down when you added the extra credit. I thought it was going to be extra. I'm going to lose my mind if you email me about that. And I'm posting a post to remind everybody about that on Monday that I swear If you email me about it, I'm probably going to remove all of your extra credit, which I reserve the right to do because there's nothing in the syllabus that says anything about me having to give you it. I've gone over it enough. People have had their opportunities. I've already got people emailing me, asking me about like, well, I only had 2 zeros for this, assignment or that assignment or whatever. And I'm like, yeah, I specifically said you are only allowed 1 0 on the pre-lab and 1 0 on the in-lab upload. And that is because I had people that had to miss it for funerals, for stuff that they cannot miss. They were in like for surgery and stuff like that. They couldn't make it up. There was no way to make it up. That's the only reason why I even have that. So that's why it is what it is. There's no arguing out of that. Your grade, as it stands right now, is your grade. Nothing else is going to be dropped. The only thing that's going to be added is extra credit and your final exam. And if you haven't completed your, quizzes or whatever that are due by tonight or whatever it is. So extra credit and exam is really it by the end of today. Your grade is what it is. There's no curve. There's no dropping any of the other quizzes. Nothing. Your grade is what it is. And trust me when I tell you, like when I took over teaching this course, a quarter of the students would fail the class. And it was what it was. So I've changed it a lot. And most people are going to pass my class. There might be a handful of students that don't. And whose fault is it going to be if they don't? Is my statement there. And so whenever you get your grade after your final exam, that is your grade. Do not contact me asking to turn in an assignment that you missed. Or, oh, can you just change my grade on, my presentation a little bit? Nope, you've had all semester to contact me and work on that stuff. And I think you guys are great and I accommodate whatever I can during the semester. But it's always at the end of the semester that people reach out to me more asking for me, oh, can I make up this? Or can I do that? Or can you just be a little bit more lenient on this grading or whatever? You had all semester to approach me with that. Do not come at me at the end of the semester asking for help with that. Do not do it. I don't have respect for it. And you shouldn't either if you were dealing with somebody that was doing the same thing. Expect more from people. You've had all semester. You've had all semester to get the grade that you wanted. Right. So, anyways, I'm just going to leave it at that. It's not probably you guys that are on here with me right now, but people that might be watching this recording later that might be thinking about stuff like this. Don't email me about how you could have turned in this assignment and it would have brought your grade up to a different letter grade. Not at the end of the semester, right? All right. What do you have any questions, Lacey? You said, can I ask you now for to make up like quizzes and stuff like that? Yeah, the time has passed, folks. So if you had a missing assignment or whatever, those things had to be done closer to it. And it is what it is. I feel like that's the responsible thing to do. This cannot possibly be a surprise to anybody, right? So if you had a missing assignment or something like that, the literally the last 4 days of class is not the time to be asking for makeup. In fact, because you would ask for that, I'm going to be way less lenient about it because you could have asked me like within a week of it being, due or whatever. Yeah, do not. No, you can email questions is fine. Email questions, ask questions about the content. All of that is fine, but don't ask for like makeup assignments or me reconsidering a grade on a presentation or whatever it is that might be affecting your grade or whatever. Man, that time came and went. Now, all you have to worry about is your exam. Study for that. Do well on that. Email me questions about the content. I am happy to do that. But any other assignments or something that's missing, don't do it, man. I just don't have a lot of respect for people that wait until the last minute to worry about their grade. And all of you guys that are on here right now, not the problem, right? So I'm just saying, yes, there's people that get to the end of my class. And this whole time that I've been telling you, I'm not curving anything, I'm not changing grades, your grade is your grade, and that sort of stuff. They get to the end of my class and they've actually got a C and they're actually getting a C on their transcript. And then they're emailing me being like, oh, well, can I make up this and that and the other? No, especially no, not now. If you'd have emailed me within a week of you not doing that assignment, I would probably let you do it. This isn't the time. So anyways, it's not for you guys that are here. It's for the people that are going to watch this recording later if they ever watch it. So, On Monday, you will get an email letting you know about the extra credit posting and then telling you guys that it's not going to be actual, it's not going to be posted as true extra credit. It's going to be graded as an actual assignment grade until your final exam posts. And then I promise it will all get sorted out and it will all post as actual extra credit. I promise. So just have the faith, trust the process. So you'll get an announcement about that on Monday. And so hopefully I'll see you guys on Sunday for whenever we do our gameplay through the Kahoot stuff. If you have any questions about any of the Kahoot stuff, whenever, because I know you guys are already playing through it some. So if you guys are playing through the Kahoot, and you have questions about any of those questions, definitely contact me and let me know what you're not understanding, because those are easy questions compared to my exams. Yeah, and so you guys should know that. There's some questions that are similar to what I have on the exam, but generally speaking, I'm trying to make sure you have the good recall stuff under your belts with that stuff, right? So that's mostly for the recall stuff. It's hard for me to write a whole Kahoot that is more comprehensive just because I can't fit the words in the questions. It has a limited number of words I can put. So, but anyways, all right. Do you guys have any other questions for me before we go? I'm rambling a lot. Any other questions, guys? You know how to contact me, email me, or whatever you need as you guys are studying, and I will try to be as responsive as possible and get all that stuff out to you with explanations wherever I can. Otherwise, have a great weekend, and hopefully I will see you guys on Sunday.